Coming to you from the Rocky Mountains of Denver, Colorado, it's NAJA News 4.
Hello and welcome to NAJA News 4. I'm Aaron Ross.
And I'm Rhonda Lavaldo. This newscast is just one of the student projects that are held each year at the NAJA Convention.
Hundreds of Native journalists and supporters are expected to attend this 23rd annual NAJA Convention.
And as this national convention gets underway, Denver is making international news. Andrew Speaker, the man who recently contracted a rare strain of tuberculosis, is still under quarantine. Speaker, who flew outside the country carrying the disease, created alarm among health officials because of the highly contagious nature of his TB. He's being treated at Denver's National Jewish Medical Center. So far, 3 tests to see if he has TB have come up negative. Still, doctors say they don't know when he will be able to leave his room. Historically, such infectious diseases have devastated Native Americans, and one doctor says the Native community needs to stay alert.
I think it could have a devastating effect. I think, one of the problems we have in American Indian communities with healthcare is that the Indian Health Service is always underfunded. And so, for example, one of the, things that people talk about is that the government pays more for healthcare for prisoners than they do for people who are using the Indian Health Service. And then again, you're dealing with communities that are very mobile and might be very rural, and then people have a hard time going to the doctor anyway.
While TB is a relatively old threat to Native people, a new threat in the last few decades is HIV and AIDS. According to the Center for Disease Control, the numbers of Native people living with HIV and AIDS are increasing annually. In 2001, there were 3,499 reported cases of Native AIDS with HIV and/or AIDS. Nearly 200 more cases are reported each year. 27% of those cases are women and 73% are men.
A Denver Native group that knows how horrific HIV can become is doing something unique to prevent the virus. Gloriana Cordova joins us to tell us about the Two-Spirit Society of Denver.
Thank you, Rhonda. Since 1999, the Two-Spirit Society has been using traditional ways in order to defeat HIV. In the time that they've helped dozens of people and have earned an international reputation for their contributions.
The group of 20 or so from different tribes gather around a table and share common struggles in support of each other.
Our role as Two-Spirit people, we're healers. And that's our traditional role is as healers. People who attend traditional ceremonies, traditional healers with HIV tend to do better. So we believe here that our traditional healers are essential for HIV treatment. And, we're out there doing prevention. But, for some people it's too late for prevention. They already have HIV, they already have AIDS, they need treatment. And, a lot of Western medicines, they don't go so far. So we really believe that traditional medicines is what our people need.
Native American AIDS prevention is a hard topic. Matthew identified what is a critical need for Native health and wellness.
I think the most important role that the Two-Spirits can bring to our back to our traditional societies is just restoration of balance and putting things back into balance. Just in terms of educating ourselves, the correct way, letting them know that this disease is something that's entirely preventable. Remember to pray. I mean, prayer is so important, so powerful. And no matter how far away you get from your traditions, they always have a way of bringing you back.
One drum beat at a time, one song at a time, one message at a time, remembering their ancestors and the rich and diverse cultures that teach how to stay well. The Two-Spirit Society is active in local and international events that promote the health and wellness of Native communities.
One of the interesting things that I learned from going and interviewing members of Two-Spirit Society was that they practice celibacy as part of the traditional practices. That's unknown in these times.
And I also heard this group is being recognized internationally.
That's right. Because of the dozens of people they've helped and the contributions that they've made, they've been invited to be the keynote speakers for the Two-Spirit Society people, and that's going to be in 2008.
Well, that's great. Thank you, Gloriana.
Thank you, Rhonda.
For the second year in a row, the Bush administration has urban Indian health care programs on the chopping block. In the 2008 budget proposal, clinics like the one we found could lose their funding source, and that has workers at the only urban Indian health care clinic in Denver in a cold sweat. The Denver Indian Health and Family Services Clinic provides medical needs for urban Indians. The clinic has about 3,000 patients, not including the diabetes program and those in the behavioral health program.
We do serve a need. There's probably, I think, about 50 or 60,000 Indians in the Denver metropolitan area, I understand, and a lot of those people do come and seek our services.
Title V government funding makes up about 50% of the clinic's budget. It also covers administrative salaries. If pulled, not only will patients be affected, but many jobs will be lost.
I think it would be a very drastic thing if we weren't able to use the services here. For one, my sister actually works here.
The only other IHS clinics available to treat Native Americans in Denver are miles away on reservations. And Nick Brokenleg, a care counselor at the Denver clinic, seems to think the current administration is sending the wrong message to the public about urban Indian health care.
The message really ultimately is stay where you belong on the reservation. I mean, because that's the assumption that urban clinics aren't needed. You know, Indian people get their health care on the reservation, and that's where they belong.
It's already hard enough for some Indian people to decide to come to the doctor. But if Title V funding is cut, getting a simple checkup could be impossible.
I wouldn't be able to get my medication, come see the doctor when I'm sick, and I can't go to the ER, so yeah, it affects my life a lot.
For 3 weeks, the two bills have been before the House and the Senate, and it could be days or even weeks before anything is decided. This leaves many of the Denver Indians waiting. There are 36 urban Indian health care clinics across the nation, and if the cuts go through, 20 of those clinics will be forced to alter their programs or even shut down. Similar programs were proposed in the 2007 budget, but they were eventually restored.
This year's NAJA conference is being hosted by two Colorado tribes, the Ute Mountain Ute and the Southern Ute tribes. They are related tribes, but do have some unique distinctions. Located in southern Colorado, the Ute Mountain Ute and the Southern Ute tribe are the longest continuous residents of Colorado. Both tribes still maintain their unique cultural traditions.
Our 118th annual bear dance, and it's been said it's one of the longest recording dances here in the United States, and it really basically comes as a celebration of harvest and the springtime.
Although the Ute Mountain Ute and the Southern Ute tribe are considered sister tribes, there are differences.
We celebrate the same bear dance ceremonies, and we also speak obviously the same language, but it's a different dialect. Some words are unique to Southern Ute and some words are unique to Ute Mountain.
The Southern Utes also have established 6 community action programs that are part of the largest and most accomplished nonprofit organizations in western Colorado. An exhibit on both Ute tribes can be found at the Colorado History Museum in downtown Denver. Both tribes are located in southern Colorado.